Thank you for joining us today on the program, Healthy Living. I'm Adesuwa Osa-Uwagye. Thursday last week, the world stood still to celebrate World Sight Day. And a lot of persons are wondering why we should have a special day to celebrate the sight. The most important thing in your body, according to some persons, is the eyes. It is the window into which we see everything that is you, okay? We are not saying those who are sightless are not important. They are quite important. And we're going to look at all of these issues concerning the sight today. Why is it important for you to take care of your eyes? What are the things you should do? What are the things you should not do? What should you put in place for yourself when it comes to the use of the eyes? Some persons don't believe in going to the hospital until it is emergency time. Your eyes may be tearing, your eyes may be red, you know, it may feel as if you have sand in your eyes. Something might just be happening to your eyes. And what people will say is go and use this local pencil, tiro. They call it tiro in Yoruba land. I think in Edo is tio or something like that, okay? So they ask you to go and use that. They put all sort of concoction in it and said, okay, don't worry. It will rectify the eye problems that you have. Put breast milk. It will make your eyes clearer. Oh, squeeze a little bit of bitter leaves and put into the eyes. Oh, go buy this eye drop, go buy that eye drop without consulting a specialist. It's quite sad. So today we have an optometrist, a senior optometrist in the house, and she's going to be talking to us about the eyes. She is from the Eyes for All Foundation. Join me as I make welcome Dr. Uwamari Ogbebo. Happy to have you join us today, Dr. Uwa.
Thank you very much.
Okay. All right, the eyes. How important?
Okay, so on the 12th, as last week, Thursday,
yeah.
We had our World Sight Day. World Sight Day is a global event where all eye practitioners, the ophthalmologists, optometrists, opticians, we come out to mark our anniversary. The eye is a significant part of the body, and the functions of the eye cannot be underestimated.
True.
So we have to actually take care of our eyes. We're on the streets. A lot of clinics open their doors for people to come in to check their eyes for free. And even as I speak, some clinics are still carrying out free eye screening. We have gotten a lot of donations from our national bodies in forms of drugs, glasses that we're giving out for free. And some of our clinics are still doing that. So the eye is important, and we really need to take care of our eyes.
Okay. So let's talk about the theme for this year.
The theme for this year is Love Your Eyes at Work. A lot of us don't know how to use our eyes with our occupation. For example, let's take the welders, people that work with metal.
Okay.
They know they ought to put on goggles, but some of them, just because they want to do a quick one, might just expose their eyes and carry out that same function, and it becomes an emergency. They'll have metal spilled into their eyes, and then we have to operate it out. So taking care of your eyes will cost you nothing, but it will save you a lot. Then we'll talk about civil servants, public servants, students, and even housewife. What do you do with your eye? You use your phones a lot, you use computers, you use other forms of gadget that exposes your eyes. The light is very dangerous to the eye, falling directly into the eyes. How do you protect your eyes? We have ultraviolet rays from the sun, and we have an anti-ultraviolet rays glasses that we can use to protect our eyes.
Okay.
It doesn't mean that you're wearing glasses means you're not seeing well. It doesn't mean that the glasses is carrying a form of prescription or the other. The glass can just be plain, exactly like what I'm wearing now. My glasses are plain. What I just have on it is a tint to protect my eyes from harmful rays.
So it's not prescription glasses?
It's not a prescription glass, actually. So you can do the same thing. When you're exposing your eyes to computer, it can cause a lot of eye strain, it can cause fatigue to the eye, it can lead to refraction error. in the eye, and that will cost you more to take care of instead of preventing these things.
Okay, fantastic. Now let's talk about the one that is immediate now, the conjunctivitis, the one that every one of us call Apollo. It is beginning to ravage quite a number of persons, you know. So let's talk about it. What are the signs and symptoms, cause of conjunctivitis? Why do we have it?
So a lot of people are going through Apollo, let me put it that way. A lot of people are going through that condition, and some of them are having self-medication, which is very wrong. Conjunctivitis are of different types. There is viral conjunctivitis, there is bacterial conjunctivitis, and there is allergic conjunctivitis. Now, if conjunctivitis presents and you start your self-medication, what are you actually treating? You have not gone to the clinic to check for the type of conjunctivitis, and you are administering an eye drop that you just got over the counter. It will not help. I've gotten a lot of calls from people using eye drop, and they'll tell me, Dr. Owa, this is not resolving.
Okay.
So I'll tell them, just come to the clinic, especially this period, like I said, that our national bodies donated drugs to us. We have drugs that we are giving out for free to managing these conditions. So if you have your eyes presenting with redness, pain, foreign body sensation, like you feel like there's sun in your eye, if you feel like there's a mucus discharge from your eye, if your eye is appearing pink instead of the regular red that everybody knows about, that's also a pointer for viral infection. You have to report to the clinic. It is not expensive to go to the clinic, actually, to just get your diagnosis and then get a proper treatment, which will save so much.
All right, tell us again the signs and symptoms, because you said there's bacterial conjunctivitis and there's viral one. So tell us, do they have the same signs and symptoms?
They actually present differently.
Okay.
For bacterial conjunctivitis, there's redness, there's pain, the eyes may be swollen, there's mucoid discharge from the eye, there's tearing from the eye, and this can cause blurred vision. For the viral conjunctivitis, it might be dry, there might be no mucoid discharge from the eye. It's pink instead of red. It can come with itching, can come with tearing also.
Does it hurt too?
Yes, it does.
Okay.
So this can also reduce vision. Then we have the allergic conjunctivitis. Allergic conjunctivitis comes with itching, it comes with foreign body sensation, so much of foreign body sensation, and when we get to observe the eye, there might be some papillae in the eye, things like rashes inside the eye. There might be some giant papillae conjunctivitis on it. So when we do that, we'll be able to know what medication is best to tackle that issue.
Okay, when treating children with conjunctivitis and adults, is it the same way we treat them?
It's the same way we treat them, yes. We use both eye drops, we use tablets to manage such conditions.
Now let's look at other things that can happen to the eyes, like cataract and of course glaucoma.
Okay.
Let's take cataract first.
Yes. Cataract is an eye condition that causes opacification of the lens. The lens is the part of the eye that we see through. So the lens is supposed to be a clear body. It's supposed to be a very clear body. So when there's any deposits to the lens causing opacity in that lens, it makes vision almost impossible. It reduces vision. It makes the person have a cloudy view. It makes the person not to be able to identify faces of even people you know at some distance, except they come closer. Cataract can come as a result of aging. Cataract can come as a result of hereditary. Cataract can come as a result of trauma to the eye, a blow to the eye. Cataract can come as a result of exposure. For example, when women that fry akara, women that roast bole, this smoke entering into their eyes, they fry gari, this smoke entering into the eyes, they are not good for the eyes. They can cause opacification of the lens. Then cataract can also be caused as a result of some systemic conditions in the body. Diabetes can lead to diabetic retinopathy. It can also lead to diabetic cataracts. Hypertension too can also cause cataracts in the eyes. So these systemic problems are something we also need to put into consideration. If you're having a diabetic cataract, it's very difficult to manage. There's no way you can go into the theater for extraction if your sugar level is not okay. So if you present to the theater with a high sugar, your ophthalmologist or your surgeon will definitely tell you, let us manage your sugar first of all before we can go for extraction. So taking care of your systemic condition is also paramount when it comes to eye issues, because a lot of systemic conditions are also revealed in the eyes.
Okay, so is cataract treatable?
Cataract is treatable. Cataract doesn't occur twice in the eye.
Just once?
Just once. If you extract cataract from the eye, it doesn't reoccur. The vision might not be as crisp as it used to be before the surgery, but the glasses can also help to enhance the vision post-surgery. So
is it possible to extract cataract from one eye and then you get it on the other eye? Is it possible?
Most times, cataracts, they are bilateral. They come in the two eyes. In cases where we have recorded just on one eye, is in cases of trauma.
Okay.
When a blow hits your eye, it might just hit just one eye, not the two eye, and then we have case of cataract. If it is hereditary, if it is diabetic cataract, or any other form of cataract, it occurs in the two eye. The difference might be that one might be more advanced than the other.
Okay.
So you remove one of the cataracts while waiting for the other one to still get a little bit mature.
But I've heard from a doctor who said that you don't have to wait. Once you have it, you know, sometimes you hear people say, oh, I need to have this operation done, but the cataract is not matured enough. We're waiting for 3, 4, 5 months thereabout. But I've also heard from a doctor who says it doesn't really matter. You don't have to wait for it to be matured, as they say.
Okay, so
how true is this?
Yes, when cataract is mature, it takes your vision a lot. It can get to the point where you just will be able to count fingers or perceive hand movements. That's what happens when the cataract gets mature. Or it might just be light perception, being able to perceive lights. When that cataract is performed and your vision is restored, even if it doesn't get up to the extent before the cataract was introduced to the eye, yes, you appreciate your vision so much again. But if the cataract doesn't get to maturity, and you're still seeing maybe half the charts, then the surgery is performed and you are seeing maybe a line difference, you won't really appreciate that. Yes, you won't really appreciate that procedure. You won't really appreciate that procedure. So sometimes we just encourage, for example, we have some people that will present with cataract and at the same time they will present with glaucoma or any other condition, maybe age-related degenerations in the eye. And when patients go for surgery, they expect 100% results.
No,
they expect
you would expect same.
Yes, of course. So because of that, their expectation, if the cataract is not so mature and they go in for that procedure and the eye comes out almost the same, they'll feel disappointed, like they've wasted money. There's no difference. There's no way you want to talk to them, like counsel them that there's something else at the back of your eyes that is blocking your vision, that is making the eyes not to see the way you are expecting.
Like what could that be?
Which is the same degenerations I'm talking about. It could be age-related degeneration, retinal pigmentosa. It could be glaucoma, depending on the extent at which the glaucoma has eaten deep into the eye. But an eye that has glaucoma and also has cataract at the same time, and the cataract is fully mature, and we know that it's this cataract that is blocking like probably 40% of the vision, while the glaucoma is taking the other 60%. When you open the eye of such persons, they appreciate vision so much. So you get to see NGOs when they are having free surgery or 50% off surgery. They have conditions for this surgery. They'll tell you your vision has to be very poor. You need to be seeing like count finger or hand movements before we can take you into the theater for this procedure. Why? Because they want you to appreciate vision when the eye is open. Not murmuring about telling other persons that are supposed to be potential patients to the clinic that if you do the surgery, you will not see well, just like that. So we just tell them, especially elderly persons, that it's difficult to explain to them. You just tell them, okay, just wait a little, let the cataract still get mature. The people that really suffer it are people that have central opacity, cortical cataracts. The eye is a round ball, the lens is a round ball. Now, when opacity comes to the eye, and it is at the middle of the eye, and it's at that middle point that the eye sees through. It takes vision earlier than for those people that have their cataracts coming from under the lens. Before it gets to the middle, it will take some time. Some people, their cataract does not even get to maturity before God calls them home. So different people have this different pace at which their cataract grows. So somebody with central opacity will not appreciate vision for too long. So in cases like that, we can tell them, you don't need to wait for the cataract to get mature. Let's extract it. That person will also appreciate vision. Yes, there are machines to take off cataracts, even at the very earliest stage.
So apart from cataracts now and glaucoma, what other thing can lead to blindness? Okay,
so we have degenerations in the eye. Age-related degenerations. We have retinitis pigmentosa,
which is
in the eye. They are all degenerations at the back of the eye. No, the back of the eye ought to be a clear body, pink in color. You just see through and you see the blood vessels all arranged the way they should be. In cases of retinitis pigmentosa, chororetinitis, age-related degenerations, there are some deposits at the back of the eye that doesn't allow the blood vessels that are transporters to have enough nutrients for the eyes to be able to see, appreciate vision. So when these things come into, they can also come as a result of diabetes to the eye. That's in case of diabetic retinopathy, hypertensive retinopathy. Those things can also affect vision.
And it can lead to blindness.
And it can lead to irreversible blindness, not just blindness. But only when you get to discover these things on time, of course, whatever is lost inside the eye cannot be regenerated. Blood vessels that are lost in the eyes cannot be regenerated. What we do is
it's quite frightening.
It's just to manage what is left. So it is easier for you to use a low vision to be able to walk around your environment, go to the market, do things for yourself, than the sight to be completely taken out, where you now have to depend on other persons to do things you should have been able to do even with the minimal sight that you have left.
So what is one supposed to do now to manage the little sight that is available to the person?
There are medications that we give.
The person is hypertensive or diabetic.
There are medications we give. First of all, you must manage any systemic problem that is causing any eye challenges. If you don't manage systemic problem and you're trying to protect your eyes, it will not work. There's still going to be a negative feedback back to the eye. So you definitely have to manage any systemic condition you have for you to have good vision.
Now let's look at our children, because I've heard most parents say, no, my child can't use glasses. At what age? Does wearing of glasses or using glasses have anything to do with age?
No, wearing of glasses have nothing to do with age. So some children might not be cooperative. Why we don't give some children glasses when we know they need glasses? Some might not be cooperative during the test. So we don't want to give an exaggerated power so that the child will not start, because children cannot report headache. Children cannot report strain to the eye. So we just tell them, okay, let them grow up a little, where they will be able to cooperate with us before we can give. Even as old as 6 months can put on glasses. Children are born with refraction error. So children are born myopic. Some are born hyperopic. So in such cases, they suffer vision.
When you say myopic, hyperopic, and all of that, you know, you're getting us confused. Exactly what are we talking about here? We need to know. Break it down.
Some people are born short-sighted.
Okay.
Some are born long-sighted. So In cases like that, the only way we can take care of such children is using glasses. If it's not glasses,
but some
there's
parents
no
would
other
never
option.
want their kids to
They are
glasses.
not doing the children any good.
Okay.
Because the more you leave refraction uncorrected, the eye becomes lazy, a state that we call amblyopia. The eye becomes lazy. And then when the child is not, the parent is now willing to, oh, my child is not really seeing, the teacher is complaining in school, the child has to go close to the boards to see. By that time, the eyes would have relaxed, and the eyes will now refuse to take any form of correction, whether drugs or whether glass. So who have you done wrong? Is the child.
It's the child.
It's the child you have done wrong. So if a doctor tells you that what your child needs is glasses to correct his or her vision, you should be very happy. You should be very happy. If you don't want to use glasses, you can use contact lens, even if contact lens has its own disadvantage more than advantages. But then it helps you not to strain. It helps the eyes to get used to good vision. It helps the eyes not to get relaxed.
Okay.
So you should use it.
All right, that's fantastic. Dr. Owa, we're preparing to carry our things to leave the studio now. Now, one word for that person out there who is supposed to use glasses and is refusing to use glasses, because I don't want people to say that I'm wearing glasses, because some persons see it as a minus for them, you know?
It's true. Okay, so the same encouragement. If your eye doctor has told you that what you need is glasses, please get your glasses and use. It will cause you no harm. If you have a frame of your choice that you like so much, you'll be willing to wear your glasses all the time. Also, I want to tell mothers, even school teachers that knows how to use their cane very well. Please, when you are using the cane for the child, avoid the face. Because flogging a child in the face and accidentally touching the eyes is going to cost so much on that child. Children have lost vision as a result of that. That's trauma to the eye. The cornea has been compromised as a result of that. Full-blown cataract has been extracted as a result of that incident. So please, we should just try and avoid accidents like that, because they are actually avoidable. Okay,
Dr. Uwa Mario Bebo, thank you so much for finding time to be with us today on the program. All right, we'll see you again soon. All right, guys, this is it. You must take care of your eyes. Bye-bye.